My name is Jan Bays. I'm board chair for the Dementia Action Alliance. As a consumer advocacy and education organization made up of many people living with dementia, care partners, and other advocates, DAA wants to be sure people understand the facts about the CMS Aduhelm controversy. Media campaigns inciting people to be upset about CMS's decision to limit payment for Aduhelm to qualifying individuals enrolled in an approved clinical study have further complicated a very complex issue. DAA holds the philosophy, nothing about us without us. Lori Shear, fellow board member who is living with early onset Alzheimer's disease and FTD, joins me today. Lori, how did DAA go about assisting people in learning about the Aduhelm controversy and gathering information from individuals living with dementia to inform the response offered by DAA to CMS?
Jan, I was really proud to be a part of all our discussions about the CMS decision. DAA's priority was to hear the voices of people living with dementia. During 3 of our regularly scheduled Zoom discussions, we presented the position of CMS and the controversy from both sides with over 50 attendees living with dementia. We then had an open discussion and listened to the voices of people living with dementia. In each group, the majority of attendees supported the decision of CMS. They voiced concerns about possible side effects, the cost to Medicare, and lack of proven results for Aduhelm. There was concern over FDA's approval in spite of the number of advisors that resigned or voted no. Most were thankful that CMS had put in place safeguards to monitor and protect people with Alzheimer's, citing that without them, we were simply guinea pigs for testing. It was pretty intense discussions.
I listened to some of those discussions, Lori. Dr. Susan Weary did a wonderful job of laying out the facts surrounding the approval of Aduhelm. That was followed by candid expressions of feelings and experiences of those directly affected by the decisions. Lori, what about you? Do you support the CMS decision to cover the cost of Aduhelm only in qualified clinical studies?
Yes, Jan, I sure do. I support the CMS decision. When most people are diagnosed with dementia, they're basically told to get their affairs in order, take these drugs, which may or not slow down the progression, and come back in 6 months to see how much you've changed. Most leave the office with no hope or encouragement, basically just a death sentence. This lack of hope leaves many vulnerable to try anything that may offer a chance to slow down progression or a cure. The CMS decision will help ensure that research and data is being presented properly and possible side effects are being reviewed properly. While the research data is properly evaluated and until there is a cure, many of us have found that the best way to slow down the process is to focus on living with dementia rather than dying of dementia. Find a purpose, get involved with others living with dementia, stay physically active, observe what enhances your symptoms, and find strategies to work around these obstacles.
For detailed information about research-based ways you can support brain health, DAA recommends you view the PBS documentary, Alzheimer's: What You Can Do. DAA strongly supports the development of drugs to treat Alzheimer's and other diseases that cause dementia. However, Aduhelm has not yet been shown to be beneficial, but it has shown to have adverse side effects, including brain swelling and brain bleeds. It is our opinion that the CMS decision serves to protect people taking the drug by requiring them to be enrolled in an approved clinical trial so that Aduhelm's efficacy and safety can be evaluated.
You know, Jan, I support clinical trials for research. And in fact, I participated in one for 2 years until it was canceled due to insufficient results.
Thank you, Lori. For ongoing resources addressing the Aduhelm controversy, please visit our website at daanow.org.